If you're newly diagnosed, you should discuss treatment options with your neurologist or your CNS. There's lots of evidence about the effectiveness of being on a disease-modifying treatment early in your disease journey. Plus, COVID-19 is most likely going to be around for quite some time yet. MS appointments are probably being done by telemedicine or over the phone at present. You can prepare for this by checking out informative websites such as MS Ireland or the MS Trust, both of whom have a newly diagnosed section and helpful information about making disease-modifying treatment decisions. You will then be able to discuss options and make an informed decision collaboratively with your neurologist about which therapy is the best choice for your disease course and your disease activity in light of COVID-19. Many of the disease-modifying therapies for MS work by suppressing or modifying the immune system. Some MS medications might increase the likelihood of developing complications from a COVID-19 infection, but this risk needs to be balanced with the risks of not being on a treatment. The ABN have published guidelines for people with MS with regards to disease-modifying therapies, and they report that first-line therapies do not significantly increase the risk of viral infections. Therefore, you can be reassured that it is safe to start a treatment once it has been prescribed for you. If you're unable to practice social distancing, then wearing a face covering is recommended. For example, on public transport, shopping, or in an enclosed indoor space with other people. The evidence suggests that they may help prevent people who aren't aware that they have the virus from spreading it to others or reduce the spread in the community. If you do wear one, you should still do the important things necessary to prevent the spread of the virus, which include social distancing, covering your mouth and nose with a tissue or sleeve when you cough or sneeze, wash your hands regularly and often, and not touch your face when your hands are unclean. If you have symptoms of COVID-19, that is a cough or a fever, you and your household should isolate at home. Wearing a face covering does not change this. A face covering isn't the same as wearing a surgical mask or the respirators used as part of PPE in the hospitals or by other healthcare workers. These supplies should continue to be available or reserved only for those who need to protect themselves against the risk in their workplace. So you should still see people who provide essential support to you, and these include healthcare workers, people who provide personal support, and social carers. These people can still visit as long as they have no symptoms of COVID-19. And when they visit, they need to wash their hands on arrival and regularly when they're in your home, and they need to try and stay 2 meters away from you if possible. If your carer develops symptoms, they must stay away from you until they have been 5 days without a fever and 14 days since their first symptoms. Then you need to contact the person who arranged your home care so they can send someone in their place. You should have a list of people who can help you if your main carer becomes unwell. Family Carers Ireland have a range of coronavirus supports and guides for carers, including an emergency care plan booklet. Home carers are considered essential workers and can travel more than 2 kilometres to get to you. And health and social care staff who do home visits have been given clear guidance on infection prevention and good hygiene practices. If they're not following these guidelines, you can contact your service provider for advice. Carers don't have to wear masks unless they're with someone who is in self-isolation or has a confirmed diagnosis of coronavirus. You do not need PPE for normal routine care if coronavirus is not suspected or confirmed. Gloves and aprons are only needed for direct personal care. All these guidelines are on the HSE website for review by anyone.